This is a cost-effectiveness analysis that's essentially based on the recently published randomized phase 3 AGILE trial, which compared azacitidine plus the IDH1 inhibitor Ivosidenib to azacitidine monotherapy in older intensive chemotherapy-ineligible patients with newly diagnosed AML. And while this trial showed an overall survival benefit with the combination therapy, it is unclear what are the health economic implications of this recent approval. And so that's why we conducted this cost effectiveness analysis. Because it's also important to kind of consider the costs of treatment of newly diagnosed AML patients, especially with an increasingly complex treatment landscape for older patients with AML. You have the recent approval of azacitidine and venetoclax. You have intensive chemotherapy for some patients. You now have azacitidine plus ivosidenib. And while in the United States, cost is not a factor in the approval, I think there's always the concern about financial toxicity and how this might affect our patients. So that was kind of the background for this cost effectiveness analysis. And we conducted a partition survival analysis model essentially based on the data from this randomized phase 3 trial, as well as estimates from the literature. And what we could show there is that under the current pricing model, the combination of azacitidine plus ivosidenib is not cost effective compared to the conventional willingness to pay threshold, which is $150,000 per quality adjusted life year. So, and then in several sensitivity analysis, we essentially found that the only parameter in our model that would make the combination cost effective is a price reduction of ivosidenib by about 60%. So our study obviously has limitations related to the design of the trial, data availability. There might be differences between real-world practice patterns, resource availability. It was based on a US payer perspective. So there are some limitations that limit the generalizability of the results, but I think it still provides potentially an impetus for the public and for regulators to maybe advocate for cost reduction and then also for other trials comparing the various sequencing strategies and see if there's a most cost-effective approach with multiple therapies available.